Thank you, Maximo. I'm sure you have noted one particular point here as emphasized, is that certification should not just target export. It should also target domestic markets. I think this is very, very, very important. Whatever will be done in improving, reducing health risk, it should take into account both domestic and export markets. May I now call upon a representative of NUIT, Purvi Mehta, who is head of capacity development, ILRI, please. She will be reporting on the parallel session that look at addressing agriculture-associated diseases.
I'm not Suvit, although I wish I was. I'm just reporting back from the session we just had about an hour ago. This was chaired by Dr. Suvit, and John McDermott of ILRI gave the overview for the session. And we had three panelists, Dominic Sharon from IDRC, Dr. Srinath Reddy from the Public Health Foundation of India, and Dr. Kaba Joyner from the West Africa Health Organization. The discussions and the recommendations basically focused on three key areas. One was establishing linkages between the sectors. The second was on creating new evidences and learning from the existing evidences. And the third, of course, was training and reaching out to the communities. In terms of linkages, some of the key recommendations that came out. One is, of course, we realized the importance of linking these three sectors, agriculture, nutrition, and health, but at the same time, there is a need to bring in some more sectors, like environment, for example, because of its implication to these sectors. Dr. Reddy said that, make this kind of interdepartmental or for the policy makers to work together, make that mandatory for the policy makers at the national or international level and also at the grassroots level, and set up clear guidelines and set up clear timelines to do so. Forecasting and evaluation in the linkages. So set up transdisciplinary groups to forecast and evaluate impact of such linkages, very, very important. And these linkages should not be only limiting within the sectors, but also among the sectors. Basically, for example, linkages between the people working on molecular biology, genomics, people working on surveillances, and so forth. So between the sectors and within the sectors. In terms of the second point, generate new evidences and learn from the existing ones. Two types of evidences. One is experimental evidences, where we let's try out new models and try out new things to establish such linkages and case studies, and also learn from the existing models of what works and what does not work. So there is a great need for documenting these kind of case studies and learning and drawing lessons out of that. And such lessons, as I said, could be positive and negative lessons from all over. Some of the examples of what works and what doesn't work were discussed also with the audience, and some of the key examples were the project that is run here in India on National Rural Health Mission, which has brought together various disciplines and has been working in such a multi-sectoral approach at the sub-district level. IDRC's malaria project in Peru, where they work with the agriculture sector and other sectors in malaria control through changing the irrigation practices and so forth. So that was discussed. Some negative examples of where linkages have not worked were also discussed. And I'll give all these details as a full report from the session later. One of the big example that was discussed was the tobacco control control campaign, so to say, where a lot of disciplines had come together and worked together internationally, nationally, at regional level, and so forth. And there are lots of lessons to be drawn out of such a multidisciplinary approach. And the tobacco story led us to a discussion on why can't we use that same approach, and the way tobaccos in many countries was taxed to reduce consumption of tobacco. It was just an idea that was floated for the audience, where why can't we use the same approach in trying to tax some of the agriculture produces? For example, some of the fatty food, for example, what Mark Rosecrans in the morning had mentioned, can we tax them to reduce the consumption? This was a debate that went on, and some of the discussion that came out of that was, one is implementing such policies will be a big challenge. And the other debate that came from some of the economists was, does really taxing or does really making a product expensive help in lowering its consumption? So these were some of the debates. Some of the points on capacity development, BB has already mentioned. Our group also mentioned those, involving community, imparting training at a very young age at the student level before they get into their silos. So let us introduce that multi-sectorial approach or thinking among the student right from the beginning. In conclusion, I think overall they said build up the spirit and culture of working together, and the second thing is let's start implementing the recommendations that come out of this conference. So this was in crux, and if you have any questions, you can look for Suvit.
Thank you, Meta, thanks a lot. Well, the first set of parallel sessions that were convened in the morning hours clearly emphasizes that the various issues raised needs a multi-sectoral approach. No single sector, institution, individual can deliver on all these issues. It needs many hands. Secondly, it has emphasized that where you would like to reduce risk, health risk, in the area of certification, you should take care of both domestic and export markets needs. And it has been emphasized, women must be at the center. These are the people who can do a lot in terms of enhancing production along the value chain, reducing health risk, because they are involved right in there. And definitely, the last one also pointed out that there are good examples of what has worked and what has not worked. Now, what has worked is helpful to prevent us reinventing the wheel. It can be adapted to suit local condition. Now, I now turn to the second set of parallel session that were covered this afternoon. And this set of sessions actually looked for lessons from past and present experiences and examine the best ways to involve partners from different sectors and segments of society. In so doing, they discussed and identified best practices to help us learn how agriculture can be leveraged for nutrition and health. And they use specific countries' experiments. And I would like, in that context, to start with David Bachman, who has been at the heart of these countries' specific examples.
Our group did look at specific country experiences. First, we heard a paper, an analytical study that looked across countries at what has really worked to reduce child malnutrition. It was an IFPRI paper. And what that showed was that economic growth, especially agricultural growth, does help to reduce child malnutrition. It also showed that focused efforts to raise incomes, improve education, improve health and the status of women among poor people, those things also work, in fact, more powerfully to reduce child malnutrition. And in most of the countries that have had durable and impressive results in reducing child malnutrition, there's been both economic growth, agricultural growth, and focused efforts to strengthen education, health, and nutrition among poor people. We heard country case studies from two really inspiring countries, Brazil and Ghana. And both countries did just about everything right. So both countries achieved good economic management, rapid economic growth, strong growth in agriculture. They also made really serious efforts to improve education, health, and nutrition among poor people. All those things came together to produce lots of good outcomes, including substantial reductions in malnutrition among their children. We also heard a country case study on this massive country of India, which has achieved spectacular economic growth and substantial progress against poverty and malnutrition, but much less progress against malnutrition than you might have hoped, given the economic successes all around in India. And so the analysis was that it may be partly because agricultural development has been less rapid than growth in other sectors, partly because of relatively weak health services, partly because of the relatively low status of women. Also, this is a very big country, so there's huge disparity in different parts of the country. So in one part of the country, you see big economic growth happening. In other parts of the country, not as much growth and much more malnutrition. I think there were quite a few Indians in the group, and there was some heated discussion about what the data really show. I drew from that we don't entirely know why India's economic successes have not achieved as much in terms of child malnutrition as might have been hoped. I was interested, one thing that was just really clear in all of the country situations that we discussed was the importance of good government, committed government. That was clear. So we talked a little bit about how do you get a good committed government? How do you make that happen? In Ghana, for example, it's not just one presidency. There's been progress against malnutrition through several administrations. So how do you get a good government? Anna Larty from Ghana said, our people have learned about democracy. So if we don't have a good government, we throw them out. I like that. I was interested that both in the case of Ghana and Brazil, one beneficial impact has come from the MDGs and international conferences. I was really surprised that a country as big as Brazil would really be influenced by MDGs, but there was some sense that the global conversation about reducing malnutrition, reducing poverty, has made a difference in many countries. And then finally, there was some discussion about the importance of champions and of advocacy within countries in achieving good, committed government.
Thank you, thank you, thank you. Thank you, David Becker, for leading us through on specific country experiences and intervention which offer useful guidance and best practices. This again is a case where it is helpful to us to avoid reinventing the wheel. By looking at this, you can modify it to your own situation.